Hi, I'm Deb Kimmett, and this is the news brief for April 18th, 2022. In this video, we cover the developments that have occurred over the last month that pertain to massage therapists. This month, we'll cover the Test to Treat program, boosters, updates on the variants, a few quick miscellaneous topics, and the big topic, wastewater surveillance. Plus, I'll have a little bonus for you at the end of the news brief. We'll begin our usual way. A shout out goes to the Massage Health Practitioners and COVID-19 Facebook group. They provide accurate, evidence-informed info, and I want to credit them for a job well done during the pandemic. They're just one of many sources that I use to gain information for these news briefs. You'll also notice at the bottom of the slides, I have an abbreviated source. The full citation is in the companion PDF file, or what I call the show notes. And before we get into the topics for today, remember that science changes, so what we know today may not be what we know tomorrow. This means that the information presented here will evolve and change as we learn more. First up is the Test to Treat program. This topic is included because there are treatments out there for COVID-19, and it's important to get them as soon as possible, because there's only a 5-day window once symptoms appear to take the medication and have it be effective. The federal government has set up what they've called Test to Treat programs that are one-stop shops where symptomatic people can get tested, prescribed antivirals, and get the medication all in one place. The program is specifically designed to prevent hospitalizations. There's a map to help you find a program near you, and that link is in the show notes. There have been several glitches with the rollout of the program. The biggest one is not enough sites, making it hard for people to get treated. And another problem is that someone has to prescribe the medication and pharmacists can't. So that's a major stumbling block for pharmacies to participate, unless they have, like CVS Minute clinics, which are staffed with a doctor, advanced practice registered nurses, or physician assistants. Advocates are looking to get that FDA rule waived so regular pharmacies can participate. Some sites are not listed because they've been omitted, or they aren't open to the general public, like Indian Health Services or military facilities. For example, the article specifically mentions my home state, Montana, where there are 7 more sites not listed because of this issue. The massage therapist takeaway: treatments are available for COVID-19, so don't delay. There's only a 5-day window once symptoms appear to get the medication in you. Try to go someplace where you can be tested, prescribed, and treated as soon as you can. And you have options. Try walk-in clinics, health department clinics, or go to the website to find a Test to Treat clinic. And again, you have options, but don't waste your time in the process. The next topic is boosters. Since our last brief, a second booster for the Pfizer and Moderna vaccines was authorized through the FDA and CDC. The second booster dose should be given at least 4 months after the first booster. The booster is available for people 50 and older, or the shot may be given to immunocompromised people. For Pfizer, that's 12 and older, and for the Moderna shot, those immunocompromised who are 18 years or older can get the shot. And immunocompromised means that they've had a solid organ transplant or those with an equivalent type of immunocompromise. A few questions come up out of all of this because it seems like we're heading to a cycle of boosting all the time. For example, is it worth getting boosted? Can we get boosted too much? How often should we get boosted, or are we going to get boosted? And which boosters should I get? So let's dive into some of that. Is it worth getting boosted? The short answer is yes. Second boosters lower the risk of severe infection for at least 6 weeks, which was the length of the study, but protection against infection wanes after 4 weeks. So even though the protection against milder disease starts to wane fairly quickly, it doesn't for severe disease, so it is worth getting boosted. Can we get boosted too often or too much? There's no evidence to show that too much boosting causes problems, like there is when you overuse antibiotics. Because the mechanisms are so different, you can't compare the two. Antibiotics kill or impede bacteria, whereas vaccines trigger an immune response. Some are basing the idea of overuse on T cells not responding or being exhausted from introducing antigens to generate an immune response. Those particular studies are based on cancer or HIV patients. And so again, the experts are saying that the mechanisms are different. When people have HIV or cancer, T cells are continually being exposed, versus when the person has had a booster, that's intermittent exposure. So again, there's just no evidence that there will be an overuse issue with the vaccine. The issue really hasn't been about not getting the booster. What it's about is getting them too soon. So when should you get the second booster? Well, the recommendation is wait 4 to 6 months after your last booster. The question about how often to get boosted is still being hashed out. Are we going to need boosters more than once a year? Is it going to be less? Is it going to be more? What's the deal? Some experts only want to base administration of boosters on the prevention of severe COVID, which means that you'd spread them further apart. Others want to look at reducing breakthrough cases. Those who want to do that are concerned about long COVID. The FDA was supposed to have put together a meeting with outside advisors earlier in April this month. Not a lot of reporting came out of that, but they were going to figure out a strategy for how often we should get boosted. Right now, though, there's no clear strategy yet. As far as which booster you should get, the FDA has been recommending mixing and matching boosters since last October. So it's okay to mix up the shot, but there's a bit of a caveat. The CDC is not recommending the Johnson & Johnson shot as a booster because of a rare clotting issue. And if you got the J&J shot as your initial dose, they recommend boosting with an mRNA vaccine like Pfizer or Moderna. And if you use the mRNA vaccines for your initial dose, scientists recommend mixing it up by boosting with a different mRNA vaccine. One of the scientists who studied this issue said that, quote, the mRNA vaccines, meaning that the Pfizer and Moderna vaccines, the mRNA vaccines are introducing different flavors of immunity. And then he goes on to say, quote, that suggests the immune system is seeing them in slightly different ways. And we know that different is incredibly important for training the immune system, unquote. The two vaccines seem to stimulate different antibody responses. So it makes real sense that when you have different COVID variants doing different things, that you want to have a broader immune response. So that's why mixing up the vaccines is recommended. The massage therapist takeaway: if you want to boost and qualify, meaning that you're 50 or over or are immunocompromised, get one. For the timing, 4 to 6 months after your first booster. And the second booster lowers the risk of severe disease, which implies that infection is possible because protection against mild or moderate disease wanes after 4 weeks. There's no evidence that overuse of vaccines is an issue because the mechanism is different. A future booster schedule is to be determined. It's up in the air right now. And again, it's recommended to mix up your boosters. Don't use the J&J booster, and we suggest getting the mRNA booster that's different from the one that you've already had. A couple of quick topics. The federal mask mandate on public transportation, such as planes and airports, has been extended through May 3rd. And the massage therapist takeaway: yep, the federal mask mandate has been extended. And as long as the federal government requires that people continue wearing masks when confined in small spaces for a length of time, it means that it's recommended for us too. This just in, literally a few minutes ago, which is a few hours before I was going to give this presentation, a federal judge overturned the mask mandate. And so we'll see what happens next, if there's going to be further court action or if the matter will be dropped and the mask mandates will be dropped. So just pay attention to the news and see what transpires. And I'll have more on this next month. The next quick topic is ventilation. Ventilation is a topic we've talked about for a long time, but over the last month, the White House held an event to put some emphasis on ventilation to fight the spread of the virus. It's not that they haven't had an emphasis on ventilation, it's just that as masking and other safety measures are rolled back, there are other things that can be done. In conjunction with this, the EPA put out the Clean Air in Buildings Challenge, which is a how-to for businesses and homeowners to have cleaner indoor air. The link to the PDF is in the show notes. And Jetalina of the Your Local Epidemiologist blog talks about aiming for 4 to 6 air changes per hour, which is ACH, in smaller spaces, which is similar to hospital standards, but recommends that the higher the ACH, the better. The massage therapist takeaway: ventilate. Keep up your ventilation protocols. We recommend a minimum of 4 to 6 ACH. Personally, I go much higher to about 10, and as I ease restrictions, I lower the amount of ACH2 to reduce the noise level, but I'm not going to go below that minimum. The next topic is a variant update. Variants are in the news, and talk about the variants tends to make people very nervous, and the press isn't helping as they try to sensationalize everything. So here's the skinny on those. We have 2 new Omicron BA2 subvariants, and Omicron XE is also in the news. If you remember from last month, Omicron XE is a recombinant variant made up of a combination of the BA1 and BA2 subvariants of the Omicron variant. It's 10% more transmissible than BA2, but there's not much data on it, so its threat level is unknown. So this is not new news. What is new is that the Omicron subvariant BA2 is behind a rise in the number of cases back east, and as of April 9th, 2022, comprises 85.9% of cases. This is substantially up from what it was just about 3 weeks earlier on March 22nd, which was 35%. That's a nearly 2.5 times increase in cases. Now, there are 2 subvariants of the BA2, BA2.12 and BA2.12.1. These are making people even more nervous because they could be even more infectious than BA2, up to 23 to 27% more. And they've spread pretty quickly in central New York State, as they comprise about 70% of cases there now. So these are being watched, but there's not much data. And the good news is that so far there's no evidence that the disease is more severe than BA2. The massage therapy takeaway: there's no need to be overly concerned about the subvariants at this time, and keep on doing what you're doing. Keep up your usual precautions. And on to the big topic for today, wastewater surveillance. As I mentioned last month, I wanted to talk about it, but didn't have time. So here we go. What is wastewater surveillance? Well, samples are taken mainly at sewage plants, analyzed, and the amount of disease in the wastewater is noted. They can be taken at other locations, like, for example, prisons are using them as well, and other locations. It's been around for a while to monitor the amount of disease, like, for example, polio and other infectious diseases. Scientists are turning to it as a way to monitor COVID-19 trends because monitoring case numbers is becoming less reliable. And that's because people are testing at home and not reporting positive cases, or they're getting sick and not reporting cases. Testing for uninsured people is no longer being paid for, which leads to less testing. There's asymptomatic spread of people not even knowing that they're even spreading it, and the increased gap between reporting of cases and the actual numbers of cases that are out there. For example, during Delta, it was estimated that 43% of cases were actually reported. During Omicron, the estimate was 26% of cases were reported, and the other 74% weren't. And now that number has dropped to 7% or so, which means that there's more than 10 times the cases out there, or at least that's what they think. That's what the scientists think. And so all of these things lead to case numbers being less reliable. But what does wastewater surveillance tell us? The CDC is using it because it's an effective and reliable way to measure COVID case trends. It samples the entire population that's on a sewer system because everyone has to go to the bathroom sometime. and it's not dependent upon people showing up to take a test, and it identifies the presence of asymptomatic cases, and it's an early indicator of case trends. Typically, there's a lag time of 4 to 6 days, meaning that cases will start to rise 4 to 6 days after the rise shown in wastewater. However, wastewater surveillance does have some limitations. You cannot tie case numbers to wastewater surveillance. The CDC reports it out as a percentage change. And one reason why you can't tie it to case numbers is that different variants shed at different rates, so it's hard to figure out those case numbers. It doesn't monitor people on septic systems, and a heavy rain dilutes the numbers. Another limitation is that not many places are monitoring it. To find out who is, you can go to the CDC. There's another group called BioBot, or your local health department can tell you if they are or not. In general, as the sources I've provided say, wastewater surveillance is good for monitoring trends, but it's important to remember how the math works and take it in context with the case numbers you're monitoring. For example, if there's a 100% change in the wastewater COVID levels, if there aren't that many cases, that's not going to be a big jump in cases, like going from 2 to 4 cases. But if you have a large number of cases already, then that change is going to be substantial, like going from 100 to 200. So keep that in mind as you monitor the number in the context of reported cases. Also keep in mind that the number of reported cases is not reflective of the actual number of cases. The number of actual cases could be more than 10 times higher. So all of this leads to the question then, well, what now? How do we use it? In general, wastewater surveillance is important to watch, but it's not the only thing to watch. In short, use it in conjunction with, but not as a replacement for, other metrics as you figure out what to do. Jedalina of the Your Local Epidemiologist website suggests also watching case numbers, test positivity rates, and wastewater. And as she says, when those trends are on the rise, quote, dial up your COVID-19 layers, unquote, meaning that you may want to add restrictions to your practice. You'll want to see if the numbers are trending up or trending down and make your decisions accordingly. The massage therapist takeaway: wastewater surveillance is a reliable way to measure disease trends. Use wastewater surveillance in conjunction with other metrics like case numbers, test positivity rates, and hospitalizations. Find information about monitoring at several different places that I've listed in your show notes. And remember, use those to help you determine what your protocols are going to be. And finally, here's your bonus information. In a previous news brief, I went through and showed you an adaptation of Jedalina's method for developing COVID precautions for your practice based on cases and test positivity rates. I've now developed a companion Excel spreadsheet that will automatically calculate the risk categories when you input those stats. And there's a place to input the wastewater stats as well. It's designed to help you keep track of your categories to explain to clients the metrics you're using. I wanted to test it in my practice first, and it works pretty well. The links, along with an explanation, are in the show notes. Take a look and see what you think. So there you have it. That's it for today. Thanks for watching. And again, please remember that science changes, so what we know today may not be what we know tomorrow. Stay safe and be healthy, and enjoy your spring.